I just want to hold up this model of the pelvis. And I'm not going to get too complicated, I don't think, about it in teaching today. But I'll show you the model, and then I'll try to build some things into it before the next class. But what I want to draw your attention to is more about remembering where the center of the pelvis is. The center, above the pelvic floor. Above the pelvic floor. So we might go from the center. And sometimes, you know, I want you to reach from the center of your pelvis all the way toward, like, say you were going to reach from the center of the pelvis to this connection between your tailbone and your sitting bone. There's the sit bone. So from the center of the pelvis, you would reach into this space all the way into how that connects to the back leg, for example. So let's just get an idea where is the center? Where's the center of the pelvis? You know? Okay? We'll keep it simple like that. All right. So we're gonna do a little work as well. We're gonna do a little nerve flossing to start class this morning after we sit, because I had a request for a little nerve work. So we'll do a little bit with that at the beginning, and then we'll move into the more formal asana practice. So let's go ahead and take a comfortable seat. And find the connection. Find your sit bones. Find the sit bones. Find your connection to the sit bones and also how they connect to the surface beneath you. And lengthening your spine all the way up. Dropping your attention down into your breathing. Practicing your balanced inhale and exhale. The smoothness. What is the smooth quality of the inhale? Pause. And the smooth quality of your exhale. And at the bottom of the next exhale, go ahead and release any control on your breath. Bring your hands in front of your heart. So from the core of your pelvis, even below the core of the pelvis is the pelvic floor. So as we chant the sound of Om, that vibration of sound coming from that deep part of the pelvis, all the way up through the front of the spine, to the roof of the mouth, chanting the sound of Om. Take a deep inhale. Sukino Bhavatu. And then with your next exhale, you can bow your head towards your heart. Release your hands and lift your gaze. Right, great. I'm just going to mute everybody right now, but of course, I want you to, if you have a question, you can unmute yourself and ask it anytime. But to begin, I want you to just kind of notice, we're just going to do a little test on the range of motion of your neck. So go ahead and turn your head to your right. And then back to center. Turn your head left. I think of it as moving my nose. Back to center, kind of noticing if one way was easier than the other. Let's tilt the right ear towards the right shoulder. And back up. And the left ear towards the left shoulder. Up. Take your chin toward your chest. Roll up. And then look up. Head, you go into extension. All right. So do you have a sense of which side, like even if you just were like, I already forgot which felt better. And if that's the case, you just, go ahead and take a turn to each side if you need to remember like which side felt tighter than the other side, because we'll start with that side. Okay. So for whichever side you're going to start on, you're going to find, like, let's say I start on my left. I don't care what side you start on. I want you to start on the side that felt tighter to you. You're going to take one of your hands. I'm just pulling my shirt down so it might make it easier to see. So there's my left collarbone. I'm going to take my hand, put it on my sternum, my hand on my sternum, and the fingers right below the collarbone. So the collarbone is here. I'm just going to anchor. I'm going to anchor here, and I'm going to anchor here. And when we do nerve work, these nerves are small. The moves do not need to be great, all right? You're not looking for your full range of motion. You're looking for what you sense underneath, the fingers. And it might be that the sensation is better here. It's best not to use the tips of the fingers. Those aren't as sensitive. They're more calloused and stuff. We're going to use a little more sensitivity there. So whatever side you picked, and you're just going to anchor that. All right. So when I anchor it, I connect to myself here, and then I'm just going to put a little weight into my hand. I'm going to draw it down towards my belly button, just a little. I'm going to take a deep breath in. So I feel the ribs expand, and also the exhale. And then I'm going to imagine there's a little balloon at my upper left ear, right up at my upper left ear. And so connecting to my hand, I'm going to side bend away from this side I'm doing. So the little balloon, let's imagine the little balloon at the top of your ear that you're doing, and just inflate the balloon a little. Now, you barely have to move probably, and you feel a little sensation. Take a deep breath in. It's not pain sensation, it's a pull. And exhale. Come back up to what a vertical. There's the slack, comes back in. We're going to do another piece. So this time, I'm going to imagine the little balloon at the top of the ear, and it's going to lift my ear slightly until I feel a little pull, okay? And then I'm going to turn my head towards that side, just a little, till again I feel a little pull. Deep breath in. Feel the ribs widening. And exhale. Come back to center. And I'm going to release my hand. Take another deep inhale. A complete exhale. And then I'm just going to turn my head and see what it feels like. Both ways. Now it's like, man, my other side. This is what I notice in my body. Yeah. So when we're working on this, if we do this technique, again, you're not looking for where you feel like, oh, there's that muscle stretching. No, you're looking for sensing where you start to feel a little, just a little pull happening, not a lot of pull. This will change over time. Like say you did this every day, pretty soon you'll get to a place where you'll have to move farther in order to feel that pull. Okay, let's do the other side. Go to the other side. So you anchor at the sternum. You anchor right below the collarbone. Let's take a deep breath there. And then imagine a little helium balloon right at the top of that ear. And let that balloon begin to lift your ear until you feel just a slight pull. Not pain, just a little pull. Take a deep breath there. Feel the ribs widen under your hand. You exhale. Bring the head back to center. And then with this little balloon, now you're going to turn the head toward the direction of this till you feel, again, oh, there's that little pull for wherever, And then inhale deeply. The ribs are widening under your hand. You're exhaling completely. And then we come back to center. And then let's release. And then let's just do a little test and see if the range of motion has changed. Did it change for you? Yeah, it feels different for me. I definitely have more ease in my rotation of my head. What about side bending? I kind of forgot where my side bending was before. The rotation was easier for me to remember. And then let's bring chin to the chest. Let's come back up. Let's do one more piece where we're going to anchor again right in the center. So we're working with vagus nerve, which is, again, it's the 10th cranial. It's the longest nerve in the body. It comes down along the carotid arteries, surrounds the whole heart, it goes all through the abdominal organs, and it's the nerve that brings that relaxation response. So the opposite of the fight or flight. So now I'm going to anchor here at my sternum, right below both of my collarbones. And oh man, if I imagine a little balloon on my nose. Whoa. And where you feel that pull, open the jaw, close it slowly, and then bring the head back to level. Oh, I forgot the deep breath, but let's take a deep breath now. And then let's release the hand. And let's just take the head up. Just to see, not just to see the sky, but just to see the range of motion. It might be great if I can go outside and look up at the sky with Maurice. That'd be cool. All right. So we did that, I forget when, but, and I just wanted to repeat it again. Jackie had requested, would I do it again? But I want to remind you that you can do this anytime, anywhere. And if you're feeling some sense of anxiety, I would do it every day. Every day I would just connect to myself. You know, here, and it doesn't even have to be skin to skin. It can be straight through the cloth, all the way into this area, and then just go through those little exercises. You can do them anytime, anywhere, and see if that doesn't help you in regards to calming your nervous system. Just think you can do it for when you're waiting for something to happen. You could do it. You know, you could do it if you are have some assignment to be checking your blood pressure regularly. It would just be a little experiment you would do. You would go, wonder if this works in this experiment. All right. So let's go back. I'm going to go back to my spot. And great. Tilt my camera down a little bit. There's the glass of water I spilled earlier. Okay. So let me see. I can remember how we were beginning. Oh, yeah. We're going to begin. I want to come up to standing, and I want to do a calf stretch. I want to open up the backs of the legs. So we had just talked about where is the core of the pelvis. So if you'll find a spot, can you find a spot at the wall? And when you do, and I know you might not be in view of me when you go to your wall spot, we'll go right foot forward, left foot back, back heel down. We're going to walk the hands up the wall. And let's have both feet pointing straight ahead. And then when you're ready, exhale and bend the front knee. And then I want to invite you, can you reach from the core of the pelvis, which we looked at earlier at the beginning. This is above the perineum. This is above the pelvic floor. Can you reach from there all the way towards the back heel? And can you breathe deeply? Feel the movement of the breath in the rib cage. Can you feel the rib cage expanding out to the sides? And can we find the upper inner heel? All right, and then we'll slide the hands down and let's switch legs. Right foot back, I look back and I go, is my right foot pointing straight ahead? Left foot forward towards the wall. Back heel is grounded. Walk your hands up the wall. They're shoulder width. Find your breath and bring the left shin forward. If your left knee goes past your left ankle, you need a longer stance. Can you reach from the core of the pelvis all the way into the back heel? Did you release the left pubic bone away from the left inner thigh? Left pubic bone away from left inner thigh. What is the quality of your breath like right now? And then like Lise, so the fibula on the left, are you, can you, if it's externally rotated at the top of the fibula, roll it medial, roll it in, okay? Good. And you might release the head between the arms. Release your head between your arms. How long is your stance? And on the back leg, and I don't know, Pat, you might take the right foot back farther. I'm not sure. But you might, it might even be another inch or so. I'm not sure exactly. But all of us were reaching from the core of the pelvis into the back heel. If we have knee issues, we're also reaching on the back leg from the fibula, the right outer knee, all the way into the back heel. Great. And then let's step forward. Sorry, those moments where I'm like, and then let's go ahead and bring the wrists down to shoulder height. Oh no, let's do forearms. We'll take the elbows at shoulder height. We'll take the hands in Anjali Mudra. We're not reaching into the elbow points. We're gonna reach into the wide part of the forearm. And then we're gonna step the feet back. So I'm reaching into that wide part of my forearm. Finding the breath. And taking my rib cage away from my arms. Millimeter by millimeter. Using my breath as I work to lengthen, to really open. I know this is a big shoulder opener. And and my elbows are shoulder width, right? They're not wider than my shoulders. I'm reaching into that wide part of my forearm. So there's a lot of strength coming towards my arms, but then I want to take my rib cage, millimeter by millimeter, towards my pelvis. And you might, Linda K, you might take your elbows a little higher. And your hands aren't in Anjali Mudra. You might have a reason for that, but you might not. So I have my elbows up the wall as high as I can get them. Great. Okay, and then we'll come away from the wall. We'll come away from that spot. And we're gonna grab our blocks. Take a wide stance. Hands up on your hips. Lifting through the top of the breastbone. And exhale, bowing forward. Hands are going to come down to either my blocks. Whatever I need here so that my legs are straight. So the backs of my knees are open. And I'm still returning to my breath. What is the quality of your breath right now? And then let's take the arms forward like downward dog arms, either on blocks or on the ground, whatever you need in order to keep the legs straight. Sometimes I enjoy just being on my finger pads and my thumb. And then some of us want to broaden the sit bones. Take the sit bones wide apart. And actively reach into the heels. So breathing in, the breath traveling in, breath traveling out. Let's see what happens, Pat, when you take your feet wider, just a little bit wider. There you go. And Ingrid, just shift the weight of the pelvis just back, like just an inch toward your heels. There you go. Wonderful. All right. And then you're going to walk your hands back, shift them up to the hips, come all the way back up to standing, and step the feet back together. All right, good. Okay, we're going to take our blocks again. We're moving towards triangle pose. So let's take your right foot out and your left heel back. A block at the outer right shin. If you need 2 blocks, please use 2. So the spine is going to be long and the weight balanced in the hips. And then when you're ready, let's inhale, take the arms out. And exhale, triangle. So I like to bring my back hand on my hip. Oh, here we go. So, on the front leg, the skin at the outer greater trochanter on the front leg, draw that into midline. So you're drawing from the skin to the bone at the outer front leg into midline. And notice, where's the weight then in your front foot? And on the back leg, from the core of the pelvis, can you reach into that space from the tailbone to the sit bone, all the way to the back heel? And then, what if you come all the way back up to the leg, the back leg, up the inside of the back leg, back up into the core of the pelvis again, and keep going. Turn the thoracic spine. Maybe turn the head, maybe lift the arm. And then we'll inhale, come up. And let's spin the feet the other direction. Does everybody know where that skin? So now your left leg is going to be your front leg. And from that skin at the greater trochanter, you know where that is. So let's inhale the arms out. And exhale towards triangle. You come down, your hand finds your block. And start at the front leg. So at your left outer hip, draw all the way into midline. Notice what that does to the weight in the hip joint the weight in the forward foot. From the core of the pelvis, reach all the way back into the back heel, the back inner heel. And then from that back leg, reach all the way back up, all the way up through the core of the pelvis, thoracic spine turning. And then the arm might reach up, and the head in a position of comfort. Good. The breath, your breath. Yeah, so the gaze can be wherever is comfortable. But just knowing the thoracic spine is turned skyward. Yeah. Good, good, great. And then let's inhale and come back up again. And let's step the feet back together. So I was talking about at the greater trochanter, right? We were going the skin right at the outside of that. We were pulling on the front leg, that skin into the bone and seeing if that brought the bone in a little bit too. Hope you felt that. We're going to take a strap. So grab your strap. And some of us will want a little loop in it. We're going to take Padangusthasana. This is hand to foot pose. So when I bow forward, I'm going to take my loop over my big toes. I can make this loop whatever size I need. I'd like my legs to be straight. My hands are either on my strap, or if my hamstrings let me, my fingers are wrapping around my big toes. The spine is straight. Okay, you can see that. Good. Your spine is straight. You're going to start lifting through the top of the breastbone. I know, it's a lot for the hamstrings. Can the sit bones still go wide? Great. And then we'll exhale, release that. You can shift your hands to your hips and come up to standing. So come to the top of your mat. We're going to take warrior one. So I'm just going to move my strap out of the way, move my blocks out of the way. Come to the top of your mat. Let's step your right foot back. So for warrior one, you're going to step the right foot back. The right foot has a very slight turnout. The pelvis is not turned out. So the back foot has a slight turnout, but the pelvis is still pointing directly ahead toward the front of your mat. Oh, and I always have to walk my foot a little farther forward because once I come in the pose, I'm going to realize that my stance was too short. Inhale, lift both arms. And exhale to warrior one. So from the core of my pelvis, reach all the way into the back leg. And as well, I'm going to reach up from the back leg, from that center. I'm going to lengthen up. I could also think of it as the medial, the inner hamstring on the back leg is strongly reaching. So is the back inner thigh. And then we'll release the arms and step forward. Step your left foot back. Both legs are straight, back foot has a slight turnout. Let's inhale, lift both arms. Exhale, bring the right shin forward. So as you bend your front knee, are you reaching from the center of the pelvis, the core of the pelvis, all the way back to the back leg? There you go. And then also reaching up. So we want these two directions in the pelvis so that we feel length and not compression in the lumbar spine. So that the lumbar spine can be long. You have to reach broadly both ways. Good. Yeah. And then we'll inhale the arms back out. And exhale, step forward. Bring your blocks forward. Inhale, lift both arms. And exhale, bow forward. Your next inhale, lengthen forward. And your exhale, release forward. Release the top of the sternum. Release the head. And then we'll shift hands onto the hips. Inhale, come up. And exhale, hands back in front of the heart. All right, we're going to take Parshvottanasana, right leg back. So we're going to step right leg back. It has a very slight turnout on the back foot. Let's inhale the arms out. And exhale. So as you bow forward, can you keep reaching from that core of the pelvis towards the tailbone, sit bone, that region all the way into the back foot. Hands come down to your blocks. So I'm going to stay connected all the way to that back leg. And then let's bow forward towards the front leg. Both legs are straight. I'm still actively reaching on the front leg, lengthening the left inner thigh towards the knee. Nancy, Lynn, and Lise are making sure that the outer left knee is broad. The inner left knee is take up a little of that slack. So on the outer left knee, you might feel that you can lengthen from the outer left knee all the way to the greater trochanter at the top of the hip. Release the head, everyone. And then we're gonna start to lift the torso. Take the arms wide. Come back up, step forward. And step the left foot back. Both legs are straight. Inhale the arms wide. Exhale, bowing forward. Hands can come to either blocks or the ground, but both legs are straight. Okay, there's a little diagonal in the pelvis. Can you get this sense that you reach into the back leg and whether you can feel crossing from the left, across the inside of the pelvis, all the way to the right and down the right leg? See if you can get any sense of this. And releasing the head forward, the torso forward. So the top of the sternum turns inward, the heart turns in. And again, we always return to noticing the quality of your breathing. And then also at the outer right knee, did you reach all the way up towards the outer right hip? And from the outer right knee, did you reach all the way down to the right ankle? What happens on the inner knee when you do that? Great, everyone. Inhale the arms out wide. And I'll come all the way up. Nice work. Step forward. Excellent, Patricia. Good job ignoring all that rowdiness behind you. All right, good. Okay, so let's see, we stepped forward. Okay, we're gonna take downward facing dog or puppy pose. So you're welcome to either inhale, all of us will lift both arms. We'll all bow forward. Some of you will step to possibly puppy, some of you will step to downward dog, some of you might have another plan altogether. Some of you might say, oh, I gotta take a sip of my cappuccino, hang on. Those of you who are in puppy or downward facing dog are actively reaching outer shoulder blades to the upper arm bones, down the center of the arm to the index finger knuckle and finger pads. We're also taking the rib cage millimeter by millimeter toward the pelvis. We're not concerned if the heels reach the ground or not. That's not concerning me at all. I want a long spine. Good. And then if you're in downward dog, you're going to come forward to plank. Those of you that might be a puppy, you might go to all fours and take, right arm forward, left leg back, just for a little work with the core. Those of us in plank, we're just being present. Present for the back of the rib cage, meeting in front of the shoulder blades. Tone at the inner thigh. If you're in all fours with one arm forward, one opposite back, switch. And then all of us, knees touch down, and we take child's pose. You can always pull a block back and rest the forehead on the block if that's a better height. And then we'll walk the hands back. I want to give a couple options now for either pigeon pose or you'll do the figure four. So here's pigeon first. I'm going to take a blanket and open my blanket up like this so it's in that shape. Put that on my mat. All right. so that when I come into pigeon pose, and sometimes I like to do this from downward facing dog, though it's not critical. If I bring my right knee forward, I'm taking my right knee out to the right and then sliding back. My right heel finds the right inner groin. Oh, you can't see it. I think I should bring that down. So there's pigeon on the right side. If your knees aren't happy with that, lie on your back and take little toe side of the right foot to the top of the left thigh to figure 4. And everyone take one of these poses, either the figure 4 or a pigeon with the blanket. Make sure if you take pigeon that you took your right knee out to the right, that it's not straight ahead, and that the right shin, we're taking it at an angle. The right shin is not parallel with the top of your blanket or yoga mat. And then if you're in pigeon, we're going to come forward to the forearms. This morning, on the forward leg when I was practicing, I also wanted to notice on the forward knee that from that outer right knee, I could lengthen back through the IT band toward my right hip to give more space at the outer right knee and take up a little slack at the right inner knee. This changes what's happening through the hip as well. Those of you in a figure 4, is the weight, can you shift the weight to be on the left side of the sacrum just a little bit? You can use the strength at the front of your right quad to draw the knee closer rather than just using your arms. All right, and then those of you in pigeon, we're gonna switch sides. Those of you in figure 4, you're also switching sides, okay? So if you're a pigeon, the left knee is off to the left. It's farther left than your left outer hip. Your left heel probably finds more like the right ligament, the right groin. I'm gonna come down on my forearms. I'm gonna broaden at the outer left knee. And I'm gonna come all the way down. If you're in a figure 4, is it the little toe side of your foot that is meeting the top of the thigh, not the ankle? Is the weight shifted slightly to the right of the sacrum so that the weight isn't on the side that's receiving the stretch? For everyone, what's the breath doing? Okay, and then we're going to release those and take again either downward facing dog, puppy, whichever version you're doing, depending on, your situation. If we're in puppy or downward dog, and you've got all this length and strength reaching toward the hands, remember that let's let the head go. Release the head. Release a little bit at the top of the sternum. Turn inward a little, even as you strongly reach toward your hands. Okay, and then we'll bring the knees down if you're in downward dog, walk the hands back if you're in puppy. All right, and let me give you, we're gonna take, if you have a spot where you've got the wall, here's a couple options. Okay, one is gonna be, I'm gonna take my blanket and fold it so that it's going to be really good padding for my knee. And I'm gonna want my blocks. Now this is if I'm gonna have a good wall spot. If I don't have a wall spot, I'll show you. If you don't have a good wall spot, I'll give you another option. But this will also work with a piece of furniture. So if you don't have a wall, because you're gonna take right knee on the blanket, right foot up the wall, you could put right knee on the blanket and the right foot on the couch or the seat of a chair. We're gonna open the top of the thigh. If you do practice reclined hero's pose or Supta Virasana, if you prefer that, if you know what I'm saying, you're welcome to take that. Otherwise, we'll meet up with the right foot either on a piece of furniture or the right foot up the wall, hands on our blocks, and the left knee forward of the left ankle. Once I'm there, go to that center of the pelvis we were talking about at the beginning and lengthen and reach all the way between pubic bone, inner thigh, the middle of the right quad toward the knee, the lower right quad toward the knee. Remember, left knee is forward of the left ankle. One more piece. Can we take our blocks and put them at the tallest height? Because then we start to lift the torso a little. So let's put your awareness, your felt sense between the right pubic bone and the right inner hip. Add a little tone right there. Little tone so that you feel like, oh, I can say more safely lift my torso. I've got a little tone right there. I'm not gonna hang in the ligaments right there. I've got a little tone between right pubic bone, right inner hip, and I'm gonna start to lengthen up through my torso. All right, and then I'm gonna scoot my pelvis back towards my foot, bring my left foot back. I'm gonna switch sides. So the left foot's gonna go up the wall, left knee's on the blanket. Give yourself a lot of padding. Right foot forward. I'll take my blocks low, and they're framing my front foot. And then I'm gonna take my pelvis away from my left heel. So pelvis comes forward, right knee comes forward. And then I gotta check back into my breathing. Breathing in peace, breathing out ease. Lengthening all the way down. So the middle of the left quad towards the lower left quad towards the knee. I'm going to take my blocks taller. I'm going to add a little tone right between the left pubic bone and the left inner hip, way inside there. And when I do, I feel supported in lifting myself up from inside my body. All right, and then I'm going to back my pelvis up. Release that, walk forward a little. Take downward facing dog or child's pose. I'm going to even take my heels up on my blanket I was just kneeling on. So I'm closing the front of the hip joint. I just had opened it. Now I'm going to close it a little. If I'm in downward dog, I'm going to bring my knees down and I'm going to meet up with those people that might be in child's pose. All right, so here's an option. Take my blanket off my mat. I want to give you the option of bow pose. So lying down on my belly. So I might be really happy with simply doing Sphinx pose. So Sphinx pose here. Or some of you, so you could do Sphinx pose in and out of it like 3 times. Where you're in that wide part of the forearm, lifting the top of the breastbone, lengthening all the way up, a lot of strength. Or some of you might like bending both knees, reaching back and grabbing maybe the feet, the ankles, lengthening through the tops of the thighs, and coming up into bow pose. And releasing. So whichever one you've chosen, I'd like you to take 3 repetitions of that pose. So all of you, whether it's Sphinx pose or bow pose, you're going to lengthen out the tops of those thighs all the way from deep inside. If you're in bow pose, you're going to lengthen the tops of the thighs, and also all of us are lifting the top of the breastbone. That's right. Yeah. And then you take a break, you come out, you rest. And just working at your own pace. You'll take 2, do a total of 3. So take your time. If you do Sphinx, just make sure that the elbows and the wrists are the same width. If you're doing bow pose, are you lengthening out the inner and the outer thigh so that the knees are staying the same distance wide? And did you find some tone at the deep belly? Rest. Releasing the last one. Let's take the right hand over the left, rest the forehead down, and take some deep breaths. All right. Then we'll take the hands and press ourselves up to all fours. And then we're going to take a blanket to sit on. We need a strap. We're going to take Matsyendrasana, Ardha Matsyendrasana 2. So right leg straight. You might need to put something under the left outer knee if it doesn't find the ground. And let's bring the left foot to the right inner knee. Let's take the loop that maybe you had left over from Padangusthasana and take it over the right foot. The tail around the left outer hip. Right hand's going to reach all the way around behind you to grab onto that strap at the left outer hip. Left arm reaches forward, grabs the strap. And we're twisting toward the right. And you might notice, even at the right outer knee, yeah, Lise and Nancy, how do you make space at the right outer knee? And when you lengthen from the right outer knee all the way up to the right outer hip, what happens through the twist? And when you reach from the right outer knee all the way to the right ankle? All right, we'll release that. We'll switch sides. Left leg straight. Right foot to the inner knee. Maybe a blanket or a block or something needs to meet that outer right thigh, shin. Strap over the foot. Tail goes to the bent knee side. Left arm, thumb down, reaches all the way behind you to find that strap, way over there. And then right arm reaches forward to find the strap. Yep, so once again, I can notice breathing. And I can go from the outer left knee, right? I could go from the outer left knee all the way across the IT band to the left outer hip, lengthen. I might even shore up a little at the slack at the right inner knee. And keep breathing. And you might even notice, Pat, you might notice as you keep turning and breathing, rotating the torso left, what's happening to your right outer hip? How do you make space there between the crest of the pelvis on the right greater trochanter. How do I lengthen that space? It might even be a greater trochanter toward the crest of the pelvis on that right side. All right, and then we'll come back to center. Great. Okay, so we're gonna take our strap, put it aside. We'll need it, but let's just set it aside. And then let's take your 2 blocks and bring them end to end. Remember the end to end. We're gonna make the little stack of blankets. If I have a bolster, I'm gonna put 2 blankets and a bolster. If I don't have a bolster, I'm gonna keep stacking blankets up there. They're folded lengthwise. I've got 2 blocks and 3 blankets folded lengthwise. If I have another blanket, I'm gonna grab it, or maybe I have a pillow, maybe I have a dog bed. I have a dog blanket, I'm gonna use that. And then I have my strap, and I'm gonna come in close to this stack, lie down, and then I'm gonna come even closer. I have to be careful I don't knock my stack over. And here I'm gonna take my strap, and I'm gonna put it around the outer feet. I don't have to, it's just gonna help hold my feet together. My knees are wide apart. I kind of like to take the strap and wrap it around my wrist so I can just relax my arms. And I've got my shins going across the blankets. My knees wide apart. I can feel the stack also at the back, outer thigh. That I want to be really close to this stack. If I know that my chin is higher than my forehead, it'd be probably worth it to have a little height under the back of the head. I can visit the outer knees again if you're having knee issues. So at the outer knee, broaden the outer knees and take up the slack that is often present at the inner knee. All right, and then I'm going to bring my knees a little closer together. I'm going to take my strap off. I'm going to roll over to one side and use my arms to push myself back up. And then I'm going to take my blankets off of my blocks. Move those off to the side. And then I'm going to make a patio for my legs. So I'm going to take one of my blankets, and I like taking the roll then toward my pelvis. So blanket, another blanket on there. This second blanket is about 1 inch back. away from the bottom blanket, and I'm gonna take another blanket. You kind of have to play around, like, what is the right number for your patio? How many? So I'm gonna use 3 blankets, and then when I lie down, I'm just gonna scoop my pelvis up to the blankets, but not on them, and take Shavasana. And then allowing your breath to deepen. Breathing in peace. And exhaling of ease. Begin to bring some movement back to your body. Bending one knee at a time, roll over to one side and pause there. Noticing your breath. At the bottom of your next exhale, you can use the arms to press yourself back up to sitting. Your hands in front of your heart. Namaste. Thank you, everyone.
Thank you, Lynn.
You're welcome. If you have